It's basically when the nerve is so sensitive that every touch stimulus to the outer surface feels like pain in some variety of ways.
Someone's saying it's like the whole back of my head and the sides of my head, like extremely numb, and certain areas are like burning and tingly.
My whole head felt like it was on fire. I'm going to go through a few things that I've done which have brought this 10 out of 10 pain down to about 5. Pretty awesome, I think. Okay. So it is best that you get started with this desensitization therapy as soon as you have the pain. That puts you at the least risk for developing an actual chronic pain syndrome. So pretty much you take different objects, like different types of brushes. Here's a toothbrush. I also have a Q-tip and a regular hairbrush, which I left at the hotel. 15 minutes 3 times a day touching my head with these different objects. That's really helped a lot. I read on the internet that taking B vitamins is also extremely helpful with these types of conditions. I actually did try to sort through some journal articles that had some clinical based evidence so that I wasn't just reading any random information, and there's still a lot of uncertainty behind how much B vitamins or any type of vitamin could actually help with peripheral nerve pain, but there definitely seems to be a trend for B12 being the most effective, and then next B6, and then there's some evidence for B1, B2, and B9, which is also known as folic acid. Overall, always consult with your doctor and make sure that somebody's monitoring you if you're taking vitamins, because you can also take too much, which can be just as much of a problem as too little. The reason why I've been taking them liquid is because I have difficulty with absorption. So that may or may not. Here we go, everyone. This is a miracle cream right here. I guess I probably shouldn't show my medicine on camera, but after I got this pain cream, I immediately stopped taking all the narcotic medicines that I've been on, which I hate those things. You have to get it at a compounding pharmacy. Unfortunately, some insurances don't cover it. It seems like it should be used more frequently because it doesn't like affect you cognitively. Like it seeps right onto the surface where it's supposed to be, and even though these are some, neurologically altering drugs, they don't affect your brain because they're just going into your skin and getting absorbed directly where they need to be. And I'm like, why have I never heard of this? And why aren't more doctors prescribing this? It seems kind of insane to me. So if you suffer from any type of extreme surface nerve pain, you've got to ask your doctor about this. The other thing I've been doing is wearing this fuzzy hat. It really helps because I don't like my head being touched right now. Although, as you can tell, I am touching it. It's not horrific. I'm trying to tame it down. But when I touch my head like this, it feels like a very bad bruise. At least it's not on fire anymore. That's what was dry. That pushes me over the edge. That fire, prickly nerve pain. I've also been stuffing some extra padding in the back, especially One of my major complaints about this surgery is that I just got my head fused to my spine, and then they're gonna put this brace right here, right where I just got it fused, and it's gonna have to press right into it. I did actually develop a lot of pretty bad general scalp issues from dryness of my scalp and not having washed it properly, and maybe it was itching, maybe, you know, I just don't know because I literally couldn't feel my head. I don't know what was going on. What's really helped is I always use Cetaphil cream on my body to help keep my neck moisturized as much as possible, because the dryness seemed to definitely be exacerbating the nerve pain for sure. I got this special shampoo that I've been washing my hair with every day. This is called Therapeutic Shampoo, Long-Lasting Relief of Itching and Flaking by Neutrogena. Number one thing that has definitely been helping is this thing called tea tree oil. And you do have to be careful with this stuff because it says in fine print on the back of the bottle you actually need to dilute it in a 1:4 ratio with olive oil because you're not really supposed to apply it straight to the skin. This is a shout out for anybody out there fighting chronic regional pain syndrome. I've come to realize that my case is honestly extremely mild and thankfully improving every single day due to the fact that my doctor was able to alert me to it and help me get started in treating it as soon as possible. My heart goes out to all of you who've been fighting this icy, prickly, hot, burning, crazy pain for some of you years or even decades. I cannot imagine the type of strength that you have. I am sending you love and strength and perseverance.